The federal government has been asked to subsidize the treatment of chronic diseases to avoid needless deaths due to financial difficulties. Now, this was part of discussions at the 5th Annual Diabetes Foot Care Workshop for health workers in Lagos on Monday. Diabetes mellitus leads to the amputation of the limbs. Health correspondent Jacqueline Ogo reports.
Diabetes mellitus, which leads to the amputation of a leg, was the focus of the foot care workshop powered by Jamaican experts and a private hospital in Lagos. It had explicit instructions on the treatment of diabetes from foreign experts who have the aim of helping Nigeria achieve the success they have recorded in curbing amputations in their country, Jamaica. The local coordinator made some points clear about the disease.
As people get older, the chances of their coming up with diabetes increases. If you are from Africa or Asian, it also increases your risk. If you've had a family history of diabetes, it increases your risk.
Another factor that can precipitate amputation in diabetes, as identified by the World Health Organization, is living a sedentary lifestyle. That is, being a person who always sits lazily in one position for hours without any movement or exercise.
If you're not meeting up to 10,000 steps a day or 30 minutes exercise a day, that is classified as sedentary. You're not actively moving around. You eat a lot of carbohydrates, you're not exercising. Of course, you will gain weight, and with the weight comes your increased risk of having diabetes.
Doctors say the biggest solution is early detection and adherence to medical prescriptions. Yemi Johnson, although an expert in the treatment of diabetes, lost his father to it due to late presentation. He says many are still dying needlessly like his dad died.
90% of my work is preventable. Most of the people who come to me have complications of diabetes, which simple things would have prevented them from either the heart attack or losing their legs.
If should something go wrong with your feet, you go to the doctor today or tomorrow latest, and not 2-3 weeks down the line, because infection set. Because once infection is set in, okay, and it's gone bad and gangrene set in, amputation is inevitable.
To stem the increase in deaths and amputations, the government is being enjoined to subsidize the treatment of the ailment because not all who don't take their drugs are careless. Many just can't afford them.
The current situation in the country is not easy for for the patients to even to buy the drugs. The drugs are very expensive.
In Jamaica, one of the ways that we have tried to overcome this is to have subsidies. The government has provided subsidies for medications for chronic diseases such as diabetes and hypertension.
Doctors say when it comes to diabetes, the price of ignorance is very high, so people must go for checks for early detection to stay alive. Jacqueline Ogo, TVC News, Lagos.